Hello, and thank you for the opportunity to present a brief outline and sample of the results of this research study, which subsequently became the topic of my PhD. For those that are unfamiliar with the drug, naloxone is a very effective reversal agent or antidote for opioid overdose. It has virtually no side effects and can quickly reverse respiratory depression and unconsciousness associated with opioid overdose, particularly if given intravenously or intramuscularly. Naloxone is routinely administered by emergency ambulance staff and ED clinicians to reverse opioid overdose. The first known project that reported take-home naloxone distribution in the form of ampoules and vials to opioid users through the scientific literature was advanced in Chicago in 1998 by Sars Maxwell and a team. Although recently published literature reports a project that predated the Chicago one and began in Italy in 1991. Wales began its own take-home naloxone program in 2009, and I was fortunate to have been a part of the national take-home naloxone group. It was at one of these meetings that a colleague asked whether it was possible for paramedics to supply take-home naloxone to patients they have treated for opioid overdose, and this conversation was the catalyst for this research study. When this study was first conceived, the bulk of evidence in support of take-home naloxone distribution was predicated on self-reported use of take-home naloxone by opioid users to reverse overdose and on estimated lives saved. International bodies, including the World Health Organization and European Monitoring Centre for Drugs and Drug Addiction, now wholly endorse the distribution of take-home naloxone to opioid users as a life-saving intervention. But definitive evidence on its effectiveness remains sparse. Take-home naloxone kits may reduce opioid overdose deaths, but distribution through community drug service providers may not necessarily reach those at highest risk. This study, which is the first to involve paramedics' distribution of take-home naloxone, aimed to assess the feasibility of paramedics supplying THN kits to patients they treated for opioid overdose at the scene of the 999 call, and the trial design and methods to determine whether a definitive trial may be indicated. This feasibility study deployed a stepped wedge cluster randomised controlled methodology with paramedics as a unit of clustering. Paramedics in the Cardiff and Vale of Glamorgan area were randomly allocated to receive training at the rate of 4 per week over the first 20 weeks of the 12-month study. Those attended by untrained paramedics fell into the control group, and those attended by trained paramedics, the intervention group. Data were gathered on processes and outcomes of care, including numbers eligible, not eligible for the intervention, those offered, not offered, or those accepted or did not accept the intervention, those that suffered further overdose via ambulance records, those that died of any cause up to 12 months following their first 999 call. We also sought to follow up patients at a personal level via questionnaire and focus group, as well as measure the rate of anonymous matching via SAIL databank to explore ED attendance and hospital admission rates. This study benefited from really good support from the paramedics in Cardiff and the Vale, with 85 of 102 eligible paramedics volunteering to take part. Of those 85, 82 paramedics went on to receive intervention training. For the 3 that didn't participate, 2 were down to long-term absence during the period, and 1 unfortunately withdrew on the day they were approached to receive their training. Over the 1-year study period, paramedics attended 181 suspected opioid overdose incidents that were linked to 158 individuals. Mean age and proportion of males encountered in this study was consistent with findings of previously published work, including that from Public Health Wales, which reported on recipients of THN kits in Wales between 2016 and 17. 140 individuals experienced one opioid overdose. 18 individuals accounted for the remaining 41 incidents, with 15 individuals attended twice. 2 individuals attended on 3 occasions, and 1 individual attended on 5 separate occasions. 61 of the 181 incidents were identified where the patient was potentially eligible to be offered the intervention. Of these 61, Take Home Naloxone was offered to eligible patients 27 times and accepted on 17 occasions. The reasons why paramedics did not offer potentially eligible patients the intervention included that the paramedic deemed the patient to be uncooperative or agitated, 9 cases where the paramedics believed the overdose to be linked to an act of self-harm, and so they didn't deem the patient appropriate to be offered the intervention given their mental state. Another 8 patients weren't offered because the paramedics didn't feel that they were suitable, generally due to a fluctuating capacity or conscious level. 3 paramedics were unable to recall the reason why it wasn't offered. In 4 cases there was no reason given, and in 2 the intervention wasn't considered by the paramedics. The one environmental factor is a paramedic cited an overdose which occurred outside the Millennium Stadium on a rugby international night, and the police, who were also on scene at the time, advised that the match was about to end and the crowds were to overwhelm the area. In addition to the 27 eligible individuals offered THN, a further 8 ineligible individuals were also offered and accepted kits. 4 of the 8 were opioid users for whom the 999 call had been made, but the call was not directly related to opioid overdose. In other words, the origin of the call was either because of an accident or a medical cause. The remaining 4 offers were to individuals that were present at the opioid overdose, but were not the patient for whom the call was made. Study records appear to indicate that each of the peers was an active or a former user. Take Home Naloxone kits were therefore offered a total of 35 times, and 25 unique individuals accepted them. Anonymised matching via sale was achieved for 152 of the 158 individuals, which has provided illuminating data on ED attendance and hospital admission rates for the study population. The table aims to show that 110 patients attended ED in the 12-month study period. 50 patients attended once, and the remaining 60 had multiple episodes ranging between 2 and 17. In total, the 110 patients accounted for 337 ED episodes or attendances. The trial methods used in this study indicate that it is feasible for paramedics to supply a take-home naloxone intervention to patients they have treated and that have subsequently recovered from opioid overdose in community settings. Learning from this feasibility study has also informed some of the methods being used in the current TIME study, particularly in relation to eligibility criteria, and reflects individuals at risk of overdose. Thank you.